This is an instructional video for the FoodSafe Allergy Test Blood Spot Collection. To ensure accurate results, please follow the instructions on this video. Some medications, including but not limited to over-the-counter medications, may influence the results of this test. It is recommended that you discontinue the use of the following medications prior to collecting. Check with your healthcare provider about this prior to doing this test. You should receive a requisition form and a blood spot kit. Before you begin collection, find a flat surface, such as a table or countertop, with enough space to lay out the contents of the kit. Laying out the kit will assist in doing the test quickly and accurately. The kit contains instructions, a blood spot card, rubber band, alcohol preps, lancets, cotton balls, band-aids, biohazard bag, and a return envelope. Write your name and date of collection on the blood spot card where indicated prior to collection. Here are some hints to facilitate the blood flow prior to collection. Drinking a large glass of water about an hour before collection. Warming hands by soaking in hot water. Rubbing hands together. Swinging arm in a circle or back and forth. Be sure to keep your arm below your heart when doing this. Collect while standing. Please fill out your requisition form completely and include your payment if you haven't already done so. Only the foods listed will be tested. Fold the back cover of your blood spot card and use the flap to prop open the blood spot card. This will help absorption and drying overnight. Be careful not to touch the inside of the circles. Wash your hands vigorously in hot soapy water. Dry your hands completely. To increase the blood flow to your hand, swing your arms by your sides while standing and keep your hands below your heart. Apply the rubber band to your forearm to act as a tourniquet to promote blood flow to fingers. The rubber band should be tight on your arm. You may need to wrap it around twice if the rubber band doesn't fit tightly. Choose a puncture site off-center of your ring or middle finger. Ensure that the site is hot. This will ensure better blood flow. Wipe clean with the alcohol prep pad. With your hand on the clean flat surface, twist the cap off of one of the lancets and firmly press your finger at the chosen site, keeping the lancet perpendicular to your fingerprint. This will be the most effective way to form drops of blood to place onto the card. Gently milk your finger in a downward motion, allowing time between squeezes for the blood to flow into your finger. Do not squeeze your finger too hard or continuously, as this could cut off the blood flow to the finger completely. When a large hanging droplet forms, touch the droplet to one of the circles on the card, without allowing your finger to touch the card. Fill the circles completely. This usually requires 2 or more large droplets. The blood spots must fill or exceed all 5 circles. Be sure that the blood is soaked completely through to the back side of the card. If necessary, use a second lancet on another finger to complete the collection. Remember, you must fill the circles in order for the test to be performed. Incomplete specimens cannot be tested. Finally, use a cotton ball to stop the blood flow and apply adequate bandaging if necessary. Allow the blood spot card to air dry overnight before folding the cover over the top of the blood spots. Avoid exposure to direct sunlight or extreme temperatures or humidity. Be sure the card air dries completely before shipping. Fold the cover over the dried blood spots and seal inside the plastic bag. Fold the requisition form and plastic bag and place them inside the business reply return envelope. Seal and mail. No postage is required if mailed inside the U.S.